So now we'll move on to our next speaker, who is Ms. Lillian Pryor. Ms. Pryor has been a nephrology nurse for more than 29 years. She currently works as a renal clinic nurse at the Atlanta VA Medical Center, where she's responsible for screening patients with chronic kidney disease and for providing them education about different treatment options. She's contributed numerous articles to the Nephrology Nursing Journal, as well as chapters to both core curriculum and contemporary nephrology nursing. She's currently the president and serves on the board of directors of the American Nephrology Nurses Association. So without further ado, Ms. Pryor, the stage is yours. I'm sorry, you're muted. There you go, now we hear you.
Very good. Thank you very much. And thank you for inviting me in ANNA to this program. And thank you, Dr. Laurie, for a wonderful presentation. I will bring up my slides and I will get started. Hold on. Okay. And so what I would like to do is just spend a few minutes discussing, oh, that's a big typo, right? COVID-19, impact on nephrology nursing. But I would just like to share a few minutes of some of the impact this has had on nephrology nursing. And thinking back, the last time I was engaged with the group was back in December of 2019. And we were kind of excited a little bit, I think, about the advancing American Kidney Health Initiative, and just kind of talking about, wow, what are we going to do, and what direction we can take, and what initiatives we can get started on making that happen. And plugging right along, COVID-19 comes and kind of disrupts, but actually just makes us kind of pivot and brought other things very much to light. So a couple of things I want to touch on in terms of nephrology nursing, the impact, of course, that COVID-19 has had on the dialysis therapies in terms of how we were delivering the therapies, and maybe seeing an increase in some of the home therapies that we were kind of taxed to do with the AAKHI. A little bit about the mental health and wellness and how that affected our nurses and healthcare in general. Some of the social determinants of health, I will touch on that just a little bit, and then of course education and training. So when the COVID-19 first hit, I think it took everybody, of course, by surprise. And what we found out quite quickly as an unexpected or adverse reaction to that was the increased amount of the acute kidney injury. And so we were actually contacted, the American Nephrology Nurses, by one of the networks. And there was, of course, the almost panic, the machines, the equipment, and then the staffing, a great shortage of staffing. And so American Nephrology Nurses Association had an opportunity to put together our nephrology nursing surge support tool. And what this was able to do was actually connect facilities that were called the hotspots, I guess, at that time, with nephrology nurses, technicians. Some were even requesting maybe dietitians or social workers together, so that we could kind of support that staffing crisis that happened. The other thing that kind of happened, we were able to also support our nurses just in terms of education. We realized quite quickly that we were going to have to collaborate quite closely with the ICUs and the CCUs, in terms of CCRT and some of that education. And even now, I'm seeing quite a bit of requests about how do we train maybe our med-surg nurses or those that are not as familiar with the therapy. How are we able to kind of get information to them so that they could also help out with this shortage of staffing that we were seeing? And so this actually went out, I want to say maybe March, the end of March, and we were able to connect, I think maybe 7 or 8 of the states that were hotspots at the time were able to utilize this tool and to connect nephrology nursing staff to those facilities that were in need. What also happened was an increased use of telehealth. And I can say in my practice at the VA, I am the pre-ESKD renal clinic nurse, and so we provided a lot of the pre-education and the clinics for those patients that had not yet reached needing renal replacement therapy. And so telehealth has just boomed. All of our clinics now, most of our clinics, we are able to engage in telehealth with those patients and just to continue that care and support, and again, just in an effort to try to prevent them or prolong that renal disease from moving forward and going forward. Transplant, we are still, I guess, working through in terms of ANA, how we can best support those patients and our nursing staff in terms of transplant. And actually, we are, again, I guess, collaborating in terms of legislative and federal partners, just to try to get the legislation moving forward and to keep it moving forward. One thing that was interesting that I saw, not necessarily related to transplant, but as we were trying to keep up with the increase in the AKI, we were able to start patients using the PD, urgent PD. And one thing I was reading not too long ago, which maybe would be a focus for us, was that the patients that may have that unsolved AKI from COVID and they received the PD, they were started on PD while they were hospitalized or discharged from the hospital, that CMS will not necessarily still pay for that, that modality. So those patients may have to end up, instead of being able to continue on that home modality, in order for the coverage, they would have to again go back to in-center dialysis. And I thought that was just kind of interesting and kind of telling, because we are trying to support and increase our home hemodialysis and our PD therapies. And so that is something that was just recognized as a barrier. And we are working to kind of just address some of those barriers. So mental health and wellness. Some of these name tags, I'm sure in healthcare, during this COVID crisis, we have all worn and could answer to any of these names. And it was just, it's brought to light the importance of how much we need to take care of ourselves in terms of mental health and wellness. At the time, before COVID-19, we were already seeing, and ANA was aware of, just maybe slight increases in nursing suicides. And so we had already started, again, a collaboration, and we're meeting to see how we might be able to address that in the nephrology nursing community. Because of the, I guess, chronicity and the longevity and the relationships that we build with our patients, we see that we lose patients quite a bit, and there's never really been an outlet or some kind of process in place for us to really process that. So we might lose a patient on Friday, and then on Monday, we haven't really had the time to kind of, you know, deal with that and kind of process that. And so then when COVID-19 came, it was just a compounded effort. And so we collaborated recently with Otsuka Pharmaceutical in terms of sending out a survey to our nephrology nurses just to get their ideas and their feelings on how ANNA can help them the best, and what programs they would need, maybe what training, and how to help them the best in terms of mental health and wellness. The nursing shortage, of course, plays into that, and burnout, all the other things, our aging workforce plays into that as well. And so we are very aware and very concerned about the mental health and wellness of our nephrology nurses, and we are working. And the results of that survey we hope to have at our fall meeting, which will be in November, to bring that out and to just to keep the conversation and the discussions going about how we would best be able to help our nurses. This, I call this time kind of a trifecta. We had the pandemic, we have the social unrest, and then we have just economic disarray, if you will. And so this slide just kind of, I guess, just kind of helped me to bring together what we probably should be doing and should be considering in terms of the care of our patients. And it's coming back, I guess, old school, and we just need to go back to the beginning and to the foundation and really start to consider all of these things that are determinants of health for our dialysis patients. And not particularly, but the African American patient, in terms of ESKD, we know that it's 35% of that population that suffer from end-stage kidney disease, yet it's 13.2 African Americans, or 13.2% of the U.S. population. And so that's one area, of course, that we really want to focus on, and I am so glad that we have an opportunity now to go back to basics and to really start to focus on this. One thing, I was listening to actually a webinar maybe the day before yesterday, and just some of the ways that we determine our GFR, and just some of the biases and things that we need to kind of address. And so ANNA is also putting together a task force so that we can start to also just address some of these with our nephrology nurses, and to help the community and get the education out there, and also just to I guess to get the feedback from the community and what do they need and how we can best help them as well. And then, of course, education and training. Immediately or almost immediately when COVID-19 hit, we were aware that there was going to be a need for education, particularly with the increase, again, of the AKI. And we put together a little package for the nurses, and this was offered free of charge, that we were able to put out to the hospitals, to anyone that may want to just get some foundational information about the different therapies, and this was offered and very, very well received. So I guess you guys remember, this is kind of, we've taken it way back. In education and training, we really got to kind of step it up, and we're moving forward into this age of even virtual technology. And I thought that was just such a funny picture of that bad dummy that was there, that we've all used for training purposes. But I say that to say that we can't do nephrology and nephrology nursing of yesterday And we need to just start looking toward tomorrow. And again, like Dr. Laurie said, what is that going to look like? And we should be able to say and to kind of plan what that should look like for the best outcomes and for the best quality care that we can give our patients. So our strategic focus, COVID-19 has brought about, I guess, an intense focus in just a bigger push for collaborations. And so we have been collaborating with many, many organizations, some of which you see here, CDS, OTSCA, again, Baxter, with who's training in PD, the large dialysis organizations, and of course ASN. And those collaborations, I think, are going to be key in just to how we're going to be able, again, to move that needle and to change the face of nephrology care and nephrology nursing as well. Advocacy, again, is right at the top of the list. And these are a couple of the organizations and groups that, again, ANNA collaborates with. AAKP is one. Of course, we have KCP, ANA, the Alliance for Home Dialysis, ASN, and many others. And advocacy, I think, in terms of those laws that affect and that are at the very heart of this systemic racism that we're talking about have to be addressed. And I know it's not an easy thing that we're going to be able to do and to overcome, but I am very hopeful that we will be able to address some of these and to dismantle a lot of the laws that are causing some of the barriers and that are allowing us not to really focus on those social determinants of health, and so that we can provide that care that our patients need. ANNA also did comment. We do every year the CMS comment letter with the PPS and QIP. And so again, we collaborate with KCP, and we're very interested and we're very involved in what's going on at that political level. And our response to it has always been supportive. Actually, I just wanted to, so I wouldn't forget, our federal legislative agenda was for the 116th Congress, includes the nursing workforce development. It includes Kidney X. We're supportive of the Kidney X and the innovative technology and the innovative, I guess, things that will help us move forward to, again, not have nephrology and nephrology nursing look as it was. We've got to see where we are, what innovations we've had, and what we've been allowed to kind of push out and do, and to keep those and then move it forward. We are also involved with, and we support the Title VIII Nursing Workforce Reauthorization Act, and of course the comprehensive immunosuppressive drug coverage for the kidney patients is key, and we're hoping that soon will be something that we can that will be passed and will be able to help our patients very, very much. Recruitment and retention is another issue that we realize. Again, we talk about nursing shortage and our just healthcare shortage. I'm sure nephrologists are also feeling just the shortage of our professionals. And so we have to think out of the box and think of innovative ways to recruit. We are forming and have formed a new to nephrology nurse task force within ANNA, where we are working actually with students. And we're trying to bring students in and just give them that early exposure to nephrology nursing. And we want to retain those nurses once we get them in. And so we're thinking of maybe flipping the script, where I guess in the past we've allowed the nurses to, we've required that they be trained in a chronic dialysis facility. And so we're thinking and you know, going with the idea, well, how about training them in acute? And letting them see that side to get them to really see how far-reaching the nephrology nursing specialty is. And because it goes from transplant to pediatrics, right, to vascular access, to PD and home hemo, and it's just so far-reaching to research. And so there are many avenues, so many avenues that we'd like to bring out to these student nurses that are coming out, and to make them aware of, and just to try to pull them in so that we can really start to move nephrology nursing forward. That would actually kind of go with some of the education initiatives we have. We offer our symposiums, one in the spring and one in the fall. But those are some of the things that ANNA is strategically focusing on. But I want to say what I think is going to be the most critical, again, is the collaborations. And the day for silos, I think, have gone. And so we all have to kind of come together, all of our associations and our different specialty practices in nephrology, to kind of lead. Dr. Lori talked about that leadership, and we should be able to come together and work together and to really set the stage and set the direction for where we want nephrology and nephrology nursing to go. So I just bring this picture, and I just remember this. It seems like it was just so long ago that this was signed as an executive order. And so we just want to imagine a world where kidney health drives in outcomes instead of kidney disease. One last shameful plug before I sign off. It is Nephrology Nurses Week, and I just wanted to get that in there. But we are proud to be a part of the nephrology community with our partners and all of the collaborations that we have, and we look forward to many, many more collaborations in the future.